Good morning, everyone. So happy to be here at St. Michael's Hospital for the official launch of Rethink Breast Cancer's care guidelines for young women with breast cancer. Young women who get diagnosed with breast cancer have unique needs. And so our care guidelines that we're here to launch today are an excellent tool, a way to try to close that gap. We think young women deserve the same excellent care no matter where they're diagnosed in Canada. And these care guidelines are both a tool for healthcare professionals to ensure that they understand and know how to address the unique needs of young women, but they're also a tool for young women, the young patients themselves, so that they can self-advocate for the proper care that they need. And we're calling on basically every doctor, every cancer center in Canada to endorse these guidelines, because we believe that no matter where you are in Canada, you deserve the same excellent care if you're a young woman with breast cancer.
And so these guidelines, as mentioned earlier, do need to be pinned throughout Canada. The rural centres, the urban centres. Early awareness and accessibility to supporting these women is crucial.
As a surgeon, the diagnosis is often made in my office. We have the ability to initiate these time-sensitive guidelines. These guidelines need to be pinned on every surgeon's wall and every breast center's wall across Canada. And through initiatives like this, we can continue to improve upon the way we heal young women with breast cancer.
I'd like to introduce Natasha Mohindra. She's a first-generation Canadian born in Belleville, Ontario. Natasha was diagnosed shortly after her 33rd birthday, and she was treated right here at St. Michael's Hospital.
I can't even find the words how essential this is, because if I had had these, it would have made a lot of difference to me, to know that I'm not alone, that everyone is feeling the same thing that I am, and that there's help out there. I was diagnosed at 33 years old. I wasn't too shocked. I'd suspected for a while that something was wrong, and I did what any young person would do. I turned to the internet to find out information, and it helped me through it provided a lot of helpful information, but it also provided a lot of scary information. And I found that there was gaps in what I needed to know as a young person and how it would affect me.
So these care guidelines highlight these unique needs and provide a framework really for awareness for both the patient, so empowers the young woman to make decisions and choices, and also empowers the healthcare team.
These guidelines are going to make a huge difference. We have to increase awareness, and it starts with clear guidelines like this, and these 10 guidelines are pivotal.
Rethink Breast Cancer developed the care guidelines for young women with breast cancer through consultation with young women for the past 10 years through our support programs, but really it was our national needs assessment where we surveyed over 500 women with breast cancer, and we really saw specific gaps in care for young women with breast cancer. The needs assessment come out of those findings and are designed to really address some of those gaps.
The guidelines are great because they give you all the information up front in a clear and concise format, and you know what's going to happen, because when you read the guidelines, you realize that these are all things that could potentially happen to you as a young woman with breast cancer. So I feel like they're going to make a difference to every young woman who's dealing with breast cancer across the country.